Hello, everyone. Welcome to Naturopathic Performance. I'm Gordon Kogan. Tune in here and on Instagram at naturopathic.performance for additional content on all things naturopathic medicine and high performance lifestyle. We discuss hot topics and consult with authorities on all manner of subjects in a way to give you high yield take home information to enhance your high performance lifestyle. Naturopathic Performance, Episode 5 Trust and Evidence Over Theory in Patient Treatment Systems. Story of Evaluation and Reinvention with co-host and guest, Dr. Matthew Tolstoy. Okay, we are here again. Thank you everyone for joining. I have a friend and colleague with me today who's been so kind to share a little bit of his time and have a discussion today about some topics I hope that are interesting. They're interesting to us for sure. We've had a little offline chat. So I have Dr. Matthew Tolstoy here, and I'll just do a quick bio, if you don't mind, Matt. He's a doctor of acupuncture and Chinese medicine, licensed as a licensed acupuncturist and somatic experiencing practitioner. He specializes in the treatment of chronic pain, anxiety, and post-traumatic stress using a combination of physical rehabilitation and body-based somatic therapy. Matt was on staff at the New York City Ballet for several years and is also partnered with the Yamaha Champions Riding School, teaching best physical practices for motorcycle riding. His aim is to help people appreciate the intersection of their physical, mental, and emotional experiences in a grounded and practical way. Matt, thank you for joining me today.
Oh, yeah, man. I'm so happy to be here. It's great to chat and reconnect. We go way, way back. So it's great to be here now.
Absolutely, yes. And as you mentioned, worked together many years ago and then have since um, transitioned off into alternate paths of further education and further diving into the wellness and health world in different respects. But we've kind of converged with a little bit of the similar studies of Chinese medicine and acupuncture. And I know we're going to talk a little bit more about that with you and a little bit about your journey, but also how you've transitioned that into what you do today. So thank you very much for taking some time. We'll also get a little bit philosophical on a couple questions here, a couple things that we'll touch on as it relates to, science, science communications and patient relationships and evidence-based practice and some things like that. So hopefully all of you listening, that this kind of rings a bell, resonates a bit on some levels, but let's dive in. So just to piggyback on your training as a doctor of traditional medicine, would you mind sharing a deep? We talked a little bit offline about this, but would you mind sharing a brief history of your journey into Chinese medicine and the application of it and the science that you have now since kind of transitioned a bit away from, and a little bit about that story that we discussed a couple weeks ago?
Yeah, no, absolutely. I think the journey that I think anybody who gets, involved in some type of clinical work, wherever in healthcare, the journey is super important because it makes you so much of who you are, and that's obvious to say. But I think sometimes we don't always appreciate until we look back, exactly. It gives so much information as to where we end up and why we're doing what we're doing. And sometimes in the chaos of clinical practice, because it's so nonlinear in its own way, that sometimes things only make sense in the rear view mirror. Like it all becomes linear when you look back at it, but when you're in it, it's nuts. So there's a lot of value, I think, in the journey. And so to share a little bit about mine, um, I started out in fitness, in New York City, working. That's how we got together, working together at Equinox. And very quickly in that process, I became really inspired by watching people take a more proactive approach to their health and how powerfully that can change someone's quality of life. And I sort of, probably within the first like 6 months of doing that, had the feeling of I want to do this in a clinical setting. I didn't want to stay in fitness. I wanted to work with people on a different slice of healthcare with different types of problems, different types of skill sets, but taking those principles of lifestyle modification, working in a relational way with somebody in that kind of role, like what I've come to term is like the difference between therapy and medicine is therapy. Somebody's like with you in that process going along the way, whereas medicine is more prescriptive, like, hey, go do these things, and comes up with a plan. And both are necessary, but I knew I wanted to work like in a therapeutic clinical setting. And so I went back and forth with myself for probably about a year and a half before I decided to commit to going to acupuncture school. And I think the options that I was weighing were trying to figure out how to balance the things that I really wanted to treat. And I really wanted to treat people who had both physical and physiological symptoms and psychophysiological symptoms, and treating that overlap in the mind-body connection. But like you said in your intro, trying to do it in like an authentic and grounded kind of way, an integrative kind of way. And the more I talked with doctors who from different practices would allow me to, chat with them or follow them or whatever, a lot of people kind of steered me in the direction of acupuncture and said, well, you might want to think about this. And I had just never thought about it. I knew it was a thing. I knew it was a licensed profession, but I had never really considered it. And then the more I looked into it at the time, the more it seemed like the best choice for what I wanted to do in terms of both physical medicine as well as mental health. And so that's how I ended up at Chinese med school, and did that for the back half of my 20s and everything. But then to address the second part of your question, I mean, the process by which I kind of had my what I call like my breakup with traditional Chinese medicine was going through the personal excavating process of my values and how I see the world and what matters to me when I'm coming up with a process by which I'm in front of somebody who's asking me to help them and paying me to help them. And like, what's that thing I really want to deliver? And what are the things that hold up the value of that thing? I just had a lot of conflict with what I was seeing, at least in America, with traditional Chinese medicine. And to at least just speak to it very generally, I ended up sort of no longer practicing traditional Chinese medicine and fell more into biomedical acupuncture and the applications of it through that lens. And that's sort of the most general, zoomed out version of like the big points of the journey that have led me to where we are right now.
Hmm. Absolutely. Yeah. Thank you for going through that journey with me. You mentioned in a previous discussion um, that that kind of, I guess you could call it a little bit of a disenchantment or like a change in course of how you're utilizing the the modality itself, as opposed to being from that the traditional theory and more of a traditional approach to more of a biomedical approach. um, we can get into maybe a little bit about what that means, but I was going to steer a little bit differently. You mentioned that kind of that disenchantment was like a similar to a loss, and you had been grieving that loss in your life in terms of something that you had invested so much energy, so much time, so much you know commitment to having it be something like you said that it has a solid footing, it has solid evidence. This you understand, like the foundation of it works because of this, and I understand why it works, and that's a valid um, it's a valid system. So, and you kind of have since, like you mentioned, kind of in doing that exploration, kind of excavating how that, and learning more and like the heuristics and learning more about, trial by fire, how something is working. And you mentioned before that maybe it's working, but for maybe the reasons that not for the reasons that they say it's working. But you mentioned that change in mentality and that change in your focus was like a life loss that you've been grieving. Would you mind just kind of elaborating a little bit more on that? Because I think people who have, in the medical fields and in certain professions who invest in something being something that's like this system works because of this, but when you ask the hard question and the foundation starts to crumble a little bit, how do you handle, losing and adjusting, losing it or adjusting your usage or your backing of that system.
Oh, absolutely. Oh, man, it's the grieving process of, if we're talking about from a professional and a clinical standpoint first, the grieving process of losing something that you were once incredibly inspired by, that then you see a little bit of the cracks in the foundation, and your relationship to it changes in like a irreconcilable kind of way. There is a unique type of pain that comes with that, and that's definitely what I experienced with traditional Chinese medicine, because there's a part of me, and still to this day, is very moved by the theory. And I love traditional Chinese medicine and culture in the way that I love beautiful art. Like, it speaks to me, and it speaks and communicates something that's very true, but it communicates it in the way that art communicates that, for me anyway. Meaning that there are works of fiction that are not necessarily factually true, but they are true in the sense that they communicate something that is powerfully real, but they themselves are not real. And so I don't think, I mean, to go right for it, like, I don't even think I believe in energy anymore. I don't know if there's like juice flowing in the body and in the world that's universal or whatever. I don't know if that's really real. I'm very open to it being real, but we have a hard time like measuring and perceiving it and finding it, which is not necessarily to say that we will not, but we can at this point. But I believe in the experience of energy, which is a different type of thing. Like, I understand what it's like to feel a sense of movement and rushing and vitality through the body that is real and helpful, and on a subjective level very meaningful, and it's the way that our system signals things back to itself. But I don't believe in the story of energy anymore, and that's the difference for me between something that's true versus something that's factual. And that's the line that I sort of drew with traditional Chinese medicine, is that, when I flip back through the texts and stuff like that, I read it and I do catch these moments where it hits me, and it's like, wow, that's really beautiful. And that observation about a certain subjective experience of the world is wonderful in a particular way. And I miss that. There's a part of me that misses feeling held by that structure inside of it, because it was a really nice place to be held for a while. And there's a lot about it that just contains a lot of really moving human truths. But when we start to apply it in a very particular kind of way for a very specific type of problem, the thing is, it kind of breaks down a lot. Not all the time, but enough for somebody like me to go, man, I don't know if I can really, what's really here. Because again, you can read something poetic and beautiful, and it can move you, and it can really help you change your relationships. It can help you in a very measurable way with the quality of your life. However, not every condition can be helped by poetry. And I wanted to be a practitioner who offered more than poetry to someone. And that's kind of the crux of the breakup for me, was that I kind of just watched the model not really line up accurately with reality all the time, and how hard I was having to work to sort of like make the math sum out. And it was like there was just this gnawing feeling inside of like, I shouldn't have to be working this hard to convince myself I'm having a particular experience. And there's something about this that feels a little off to me. And that was the seedling of that experience, which eventually grew into, yeah, man, I don't know if this can be the primary thing that you offer people and feel intellectually and personally honest about it.
Mm. Wow, so eloquently said and communicated. I really appreciate that, and it's so interesting that you mentioned some of those words there, like the story of the theory, and how then and and I felt exactly the same in my studies of traditional Chinese medicine, um, from a naturopathic medical study standpoint. And the theories that we would have studied are the same, and I totally felt some of those similar feelings, the inspiration of, once you finally get enough of that understanding of what of how the system is explaining things and how that story is painted and how you're able to manipulate that story, it really is, excuse me, it really is, like you said, a beautiful and inspiring, um, basically canvas that they're painting in terms of this energy flow and how it can be treated and manipulated. And I mean, I've had some extremely positive experiences with my, Chinese medicine, studies and treatments with patients and acupuncture, et cetera. But I just think that you just really explained that so eloquently, how that process for you and that disenchantment kind of has led into feeling of that grieving, and what it means to look at something from an epistemological perspective, and like how that knowledge is gained, and how that knowledge is validated, right? And so, throwing out that word, I was introduced, to epistemology by a supervisor of mine, just this, during my clinical year, who takes a very practical, evidence-based approach to everything he does from a naturopathic medical standpoint. And the more you dive into it, you explained right just there that as practitioners and as in we we kind of have a responsibility to look at, um, where, like, constantly be evaluating how that knowledge is accumulated, how it's validated, and how it's different from an opinion versus a justified belief, and like a justified, evidence validated belief fact system that, we're able to then share with others, like you said, from a responsible standpoint. Like you wanted something to stand solid on for your practice, from a from a moral standpoint, that you just felt like, I need this to be stronger in order to go forward with it, right? So, um, just to rewind a bit for those out there listening, I'll just define epistemology, because I had to wrap my head around this, and I was like, "What? Like, what are you talking about? Like, we're like studying we're looking at the studies, we're studying the evidence, we're studying the evidence." But I was like, "Wow, this is new on me." But epistemology is basically the theory of knowledge with respect to methods, validity, and scope. Essentially, as well, the investigation of what distinguishes justified belief from opinion, which I mentioned before. And it seems like, kind of like, wow, what does that even mean? But I think we're trying to get at the point where, you know, yes, there's evidence, there's science, there's the research, but even then, we're in this position where we're trying to take that evidence and figure out how it was even formulated, and is that formulation of that evidence even valid? And then how do we communicate that with ourselves, and how do we digest it? But then how do we validate it into a professional product, into a service, and into communicating with our patients and clients, right? So that's kind of where I wanted to like transition into. That was long-winded, but I think you got, based on your presentation and your description of that breakup, kind of like led us into that discussion. So, do you have any further thoughts on anything that I just went through, and how that might connect to what we were talking about previously?
Yeah, absolutely. I think that the question, you know, the topic of epistemology, which is essentially just how do you come to know and believe what you know and believe? Like there's a process, there's an architecture that we go through mostly unconsciously that has us look at something and just reflexively feel like, oh yeah, that must be true and that must be wrong and whatever. And that happens in an instant for most people, or like there's a couple little thoughts, but there's this whole system inside that the more we can make it conscious and realize like, oh, that's where I'm kind of fudging the numbers a little bit in order to believe this thing that I'm really trying to believe, uncovering those types of bugs in the human software, which are natural to all of us because it's just been put in there from, evolution over time. It's how our system adapted to process information. And so the more we can uncover about that, about what we do and how we help people, the more that we can get to something that is, said, like much more solid and real and outside of our own bias. And so my own personal journey with that was, yeah, I would just watch a lot of these acupuncturists and traditional Chinese medicine practitioners that I was surrounded by, or other students. I just didn't, when I really started to learn about how to break that process down of knowledge acquiring and questioning yourself and trying to get to something that feels honest, it just began to feel like it was so riddled with these very simple cognitive errors that we've learned through, like Daniel Kahneman's great work about bias and investigating like the psychology of how we come to be easily fooled by ourselves, and how the framing of the same information but slightly differently will make us answer questions differently, and the way that our hardware is just so susceptible to confirming what we want to confirm and not with whatever. And I saw it was just so rampant in practice, is basically where I'm going, is that it felt like in order to remain a part of the traditional model, I had to just submit to my own confirmation bias and ignore what happens when we test things in a more controlled way. And so, a lot of people in the alt medicine, complementary healthcare field often say, like, listen, anecdotal evidence is the only thing that matters. Life can't be controlled. You can't control for everything. And when we make an artificial study, like a randomized controlled trial, sure, we can, that becomes a victim of its own framing, right? Like, yeah, sure, you set the frame to look a particular way and then it came out, well or not well. And that's its own form of manipulation of reality that is not complete and therefore useless. So it only matters what you see in clinic and what you see work and what you feel. And it's like, well, I've come to think of it like a diet. You got to have a balanced representation of these different zones. If you say, listen, the only thing I need to know is what I can observe, I see it work for my patients, and that's all that matters. That's kind of like saying, if somebody says, hey, where do you get all your physical energy from? It's like, well, I eat a ton of sugary carbs. It's like, well, there's a time and a place where sugary carbs are very, very useful and very, very helpful and should be in your diet. But like, I don't know if that should be the whole freaking thing. I don't know if that should be even the base of your pyramid. It should be a part of it, but like, I don't know. And I think ultimately, at the end of the day, as practitioners, clinical practitioners, we all have a belief about this topic that is either conscious or unconscious. It's probably unconscious for most people. But the topic we all have a personal opinion about that drives all of our behavior is this: do we believe or not believe that there are things outside of our own individual perception and experience that are worth knowing, that should change what we do? Or are we capable of, just through our own day in, day out in the office experience, watching, getting feedback from people, is that the only information that you need? And people have one or two thoughts about that. And personally, I believe that there are things that are important to know that are outside of my first person perspective. There are things that I can't know from my first person perspective. Speaking of, human evolution and our software inside the nervous system, like our perceptual processing information, hardware was not set up to process information at large scale. It just has not been groomed by evolution to process all the variables outside of maybe like 50 to 100 people that are in our first little group. And now we're talking with, the way that the modern world exists, things at global scale. Like, our notions about just what reflexively feels true are probably, the bigger the circle gets, the further away from reality it's going to be. And so, to bring this all back to practice, is that these bigger concepts of epistemology, like how do you really come to believe what you believe about what you do with somebody in the office, if it's just being driven by, well, this works for me and works for my patients, people only tell me good things about it, and so the end, and to not have any feeling that People are probably underreporting because they don't want to disappoint you. You're probably ignoring the moments when it doesn't fit the pattern because the brain's going to downplay the stuff that hurts and downplay the stuff that breaks the model because we're trying to have consistency across our worldview. And if we just like never consider those things, I think we end up being a really small and ineffectual version of who we could be in the clinical setting.
Mm, yeah, I would definitely agree with so many of those points, and I think we're as clinicians we're put in an interesting spot, um, to be the applicators of the evidence, right? Um, we're applying the evidence to that that's out there, and like you said, like what evidence are we using? What kind of bubble are we sitting in, and how are we accumulating that, and then how are we translating it into our practice and what we're using, depending on the field and the modalities and the types of conditions that you work with. So I think we we are put in that really interesting spot to, and we can kind of create that little bubble of evidence and use it, because like you said, like sometimes it's if you're not reaching outside and really asking the hard questions of your system, and you're getting all this tremendous feedback, like, oh, that feels amazing, like why would you ever leave? Right, like I feel great, like I'm making money, my patients are happy, I'm like, you're crushing it, but like, hold on a minute, like if you're living in this like evidence bubble and this application bubble that's only so large, and so and like you said before, I think expanding that, the responsibility to look outside of that and ask the hard questions of what you're doing. I think that's just like an ethical thing. And I mean, some people might not worry too much about that, but I've run into a similar thoughts, similar concerns, ethical, situations, just from like, okay, what do I want my practice to look like? Like you said, years ago, as you're building, and it transitions, it can transition all the time. And I think that's fair, based on new learnings and new evidence. But um, it kind of transitions me into my next question, because you have had some like thought-provoking social media posts recently about this exact topic, relating to asking the hard questions of a particular practice system and doing the investigation, and like being critical of those, whether they're individuals or you're having conversations, those individuals that are unable to provide you with examples of why the system that they use might not, but like the evidence gaps, right? What's a shortcoming of it? Like, have you really looked into it? Um, can you elaborate a little bit on that criticism, and maybe some examples of what you mean?
Yeah, for sure. I think that one of the dynamics at play when we're talking about not just our formal education, but then the continuing education of where our practical execution of what we do settles into as we specialize and as we find our groove in our practice of like what we treat and how we treat it and find the techniques that suit those things, is that going off of this human tendency for confirming our own points of view and overemphasizing the wins and downplaying the losses so that the picture looks better. This becomes true of all the things that we engage with. If you're a certain type of three-letter system that is your movement background that you use for training or rehab or something like that, and then that becomes the lens through which you see the world. There are many great quotes that illustrate this point. That say that all models are wrong at some point. Like all models are imperfect, but some are useful, and this is where the balance of clinical practice, I think, really becomes having a measured relationship to what we do, not being so over the moon in love with any particular one thing, because then it's just so easy to have our perception hijacked by being in love with a system or in love with a process that then stops us from being in love with results. If we continue to serve the system because we really want the system to be right, and then that recontextualizes sometimes then what we see happening in real time with the person in front of us who's breaking the model as we speak, but we refuse unconsciously to let them break the model and then exist outside of it because we're holding on too tightly to the model. Now, we would never say this or want to do this consciously, but unconsciously, if we unpack the behavior, we're now serving the model ahead of the person. And it's natural to do that. It's not like anybody's personal, individual failing because they're such a terrible clinician. This is what we're all susceptible to. And so it's something that I think we just constantly need to be keeping in check with. I was talking about this with somebody the other day, and I just say, like, I just argue against my point of view all the time. Like, I'm like, all the time I imagine, it helps me to just imagine myself as taking on the point of view of somebody else who probably hates what I do, and I know enough of them on social media who probably think acupuncture and dry needling is nonsense, or think somatic therapy is stupid, and like, whatever, it doesn't matter. But just be like, okay, take a breath, and what would so and so probably say about what you do, and what would be their best points. Not make them out to be some jerk, not out to be some gotcha person on the internet. Put all the caricatures away. If you were to sit down and have a really deeply meaningful conversation with this person where you both were really, really moved by it, what do you think this person would say, and how do you think that they would be able to really touch something meaningful inside of your thought process? I just do that all the time. You know what I mean? And I think that it's important to do, because then it lets you not take what you do so seriously. You can still take your practice and your patients very seriously. And I would argue taking them seriously requires you to not take the things you do seriously, because it means you can put the tool down and you can pick something else up, because I don't give a shit about the hammer. I'm here to figure out what your problem is and how I can best help you, or get you to somebody who can help you. And so I think if that's the ultimate value, we have to have a very sort of laissez-faire relationship to the tools that we use. It doesn't have to be one or the other. We can still take the tools very seriously, but how to code shift and just get out of that and just switch out of that paradigm, put it down, pick up something else, and be as flexible and dynamic as possible, because you're not trying to use that tool anymore to enhance a level of clinical and personal rightness that is then maybe unconsciously running your decision-making process, instead of, I don't really care if I'm right, I care if I'm successful and helpful.
Yeah, absolutely. Just that segues into like the concept of the humility of allowing for the possibility of there to be, like I said, those shortcomings and those evidence gaps. And like you said, I don't care what the tool is. I'm gonna use what I know best, and if I can't help you, then I'm going to find someone who will. And so that leads me into my next question of, balancing that. How does balancing that commitment to your model, to your product, to the things that you've invested in, you rely on to make a living. How do you balance that commitment, evidence, everything else, kind of included and wrapped up in there? How do you balance that with the responsibility of the science communication and the treatment communication with your patients, and the ability to fluidly flow in and out of that, like you said? How do you manage that?
Mm-hmm. It's hard. It's really hard. It's hard on a personal level inside. It's hard to hold all of those contradictions inside of how evidence says this, evidence is not working for this person. I kind of think this might work. Will it not work? How do, like, when do you when do you go rogue and when do you not? And valuing both, because both are applicable. It's for working from the inside out. It's hard to hold that just personally. And then when we talk about relationally, how do we communicate that to other people? Is that, I think, I don't know, I've just gotten really, really, really honest in clinic, where I tell people, I say I don't know all the time to people. I say, really, I don't know what's going to happen. I don't know if that's going to work. And then I follow it up with, well, this is why I think that this is relevant for you, because we saw this and we saw that. And if this happens, this is probably what we'll do next. And if that happens, that's probably what we'll do next. And show that you don't have to have an answer. You have to have a process. And the process has to be like intellectually sound and reasonable. And then I find more often than not that improves the therapeutic relationship, which is probably the most important thing anyway in the line of work that I do, so that there's a level of trust with being held inside of a process, and I'm not being prescriptive. I'm going to tell you some stuff that I can't know. I can't really, really deeply know until it happens.
Right. Yeah, you said there having a process, the honesty is number one, of course, in that therapeutic relationship, and being able to be humble enough to say I don't know, but also you mentioned there just having a process versus always having to have an answer, right? Like that's so okay, yeah. So that concept of having a process versus always having the answer resonates a lot as well. So just explain that once again, you know, with such a such a really solid and kind of eloquent way, but that responsibility of communicating science with our patients and with people is once again we're put in that really interesting place where we're not the scientists, we're not the researchers, but we're also trying to take this evidence and really you know do the best we can with it, and or I would like to think so. And because that evidence is always changing, but first evaluating the quality of the evidence, like what are you standing on? Like you said, there's the evidence pyramid. Hopefully you're not standing on something that's um, only one part of that evidence pyramid, or something that's like at an extreme end, or what have you. But um, that kind of leads me into one of our final kind of topics and questions is building off of that humility factor and the and that evidence-based approach. I think it's literally like, especially in the complementary medicine, naturopathic medicine world, it's literally like the term that almost has to precede everything that we're doing, that we're posting. Like I'm evidence-based this, I'm evidence-based that, and it's like ad nauseum everywhere. And like we're not like, it's not like we're validated just to be like I do this. It's like like traditional medical doctors aren't like I'm an evidence-based urologist, right? Like it sounds ridiculous, doesn't it? Like, so we are we are in kind of in that complementary medicine world, almost like obligated now to like to announce to the world like we use evidence-based methods. It sounds kind of weird now that I just keep saying it 1,000 times, but that's what I feel, because every post from someone in our world, or every profile that people are that they like, you're almost like I have to put this, like I have to put it. And that's maybe my self conscious. Maybe I have to do a little digging on why I feel that way, but maybe you've run into this, maybe you haven't. I'm sure you have. And how that also gets essentially kind of, for lack of a better word, kind of manipulated, or um, almost like bastardized in a way, like put it kind of almost like conflating like evidence-based, and that kind of under that guise of evidence-based, with like high quality care or high quality services. Can you just kind of respond to that a little bit? That might bring up some fun stuff for you.
Yeah, no, absolutely. I think that when we're talking about, there's a couple things at play here that I think when we turn towards this trend of many people in the alternative medicine community trying to use the term evidence-based or whatever, is that I think it's a feature of something social and cultural right now, with the explosion of social media and the explosion of healthcare businesses being represented on social media in a completely unregulated kind of way, that it becomes increasingly important. And at least I can speak to this a lot from my personal experience. Many people have chosen not to come see me at the referral of a friend or colleague or whatever, simply because I'm an acupuncturist. And they're like, man, I don't believe in energy. And I think all that stuff is kind of like woo and out there and whatever. And so I've had to work very hard to be like, listen, I'm not that guy. Like, I'm just some white dude from New Jersey named Matt. You know what I mean? Like, I'm not the guy with like the scrolls on the wall. There's not going to be a gong. Like, I'm not live action role playing some sort of guru role that a lot of people in America play when they're an acupuncturist, that perhaps turns many of the people whom I think that I would work well with, it turns them off. And so I've had to work I've had to come to the realization, and second of all, work on the fact that simply representing myself as an acupuncturist is not great for me. Simply because on both sides of the spectrum, for people who are not into it, like I just mentioned, it's like, hey, listen, whatever you think of as acupuncture, it's probably not even going to be what we functionally do. It's going to be a different hour that we spend together. So don't worry about it. And then secondarily, people are like, wow, I love acupuncture. My acupuncturist was so great. They looked at my tongue, they felt my pulse, I felt so seen, and I felt so, is that it's like, oh man, that's tough for me too, because it's not going to be that either. And so it's been a struggle for me to speak, to my own experience first, that I've had to work hard to be like, this is the type of thing that I offer, because if I just rely on the words like I'm a licensed acupuncturist, man, it puts me in a really, really, really tough position for the people that I want to help and the people that I'm probably best suited to help. So it's a problem that I've tried to sort out, but it's, I think, also a feature of how we represent healthcare in a completely unregulated social media kind of platform that way. And it also does, I mean, people, when we talk about informed consent, like they need to know if they're showing up for a shaman or if they're showing up for a biomedical alt med person, like just simply from an informed consent standpoint, because somebody says, that they're a naturopathic doctor, somebody says that they're an acupuncturist, even somebody says that they're a physical therapist. It's like, I have no idea what you do. I have no idea what you believe. I have no idea what's guiding your treatment. And so there's this weird qualifier that always has to happen. And I think that for people who exist on the conservative side of alternative medicine, there is this continual like embarrassment and like kind of crowbarring away from like, hey, listen, whatever you think of as like the woo crazy person with crystals and shit and like whatever, they have a right to be there. We need a lot of people to help people, but I'm not that person, so please don't worry about it. Like, that's not me. And like, how do you communicate that in a way that is not weird, that doesn't break the process, that doesn't call too much attention to it? It's a hard little wrinkle to get over and to do really smoothly. But I think some element of it is how unregulated healthcare has become as a result of the information age. You can do a Zoom appointment with somebody halfway across the world if you want to now. And
Mhm.
so our ability to communicate accurately around that, I think, escalates with the way that our reach can escalate because of the accessibility of the internet.
Yeah. Yeah, really good points. I think as well, we, kind of in that, taking kind of the complementary or functional medicine, professions as an umbrella. I think there's also just an increased, yeah, like you said, with the social media and with the increased awareness to the public and to culture of these professions, and some of them, at least in the modern day application, some of them are quite new, and some of them, obviously, like traditional Chinese medicine, quite old. Um, but like you said, it's confusing for people, right? Because there's so many of these new offshoots of CAM, complementary medicine, functional medicine. And man, I mean, even for myself too, you go on somewhere, and I think that's an interesting point you made. How do we as those practitioners communicate what we do, obviously in a responsible way and in an informative way that gives the patients and the potential patients and clients a way, like an informed consent way to choose, to decide if they're going to go that route or not. But yeah, I just find it so interesting that we're still compelled to use this language that kind of like gives it some sort of almost like a faux, um, faux validity on top of what we're doing, right? So I'm kind of fascinated by it, and I'm so guilty of it too. I think all of my profiles have something about like, functional naturopathic medicine, functional medicine, evidence, the evidence based, using these different modalities and things like that, right? So I'm kind of like internalizing this as we're having this conversation, and it's kind of coming out. So I'll be intrigued to sit with this one for a while after, but it definitely connects to this whole concept of, you know like there could be some interesting negative examples of like what's hiding behind those words, right? People kind of just being like, oh, you know I like just putting evidence based in front of what you do, and then not really following up on that. Obviously, there's the horror stories and the bad examples of every profession out there. But um, you said a quote when we discussed when we talked last about something along the lines. And excuse me if I don't get it 100% right. It said something like, "I'm a fool to myself, and I'm the easiest to fool." Is that it?
Oh, like, yeah, you
No.
mustn't be fooled, and you're the easiest person to fool. You know what I mean? And
Yeah.
so
Yeah.
this idea that, yeah, that going back to the first part of our conversation, just that we have millennia of evolutionary momentum behind. Somebody said this to me once, and I think it's a great way of articulating this point, is that nature evolved our perception and information processing to feel like we're right, not to be truthful. Because if you think about it, if we have enough of a feeling of being right from just a strictly evolutionary pass on the gene standpoint, that's an advantage rather than to be crippled by looking out into the complexity of the world and realizing like, oh, should I second guess myself or something? Like from a purely like naturalistic evolutionary standpoint. Of course, those two things have to line up because there are dangers in the world and you can get eaten and so it's not about only feeling right, but it's like this weird blend of getting the right mixture between really accurate perception, but then also enough to just like feel confident and right, that it's a natural thing inside of us to want to fool ourselves into believing we're more right than we are, because for the longest period of time in evolutionary history, that has been a survival advantage.
Hmm.
But now, in the information age, where most of our threat and most of our survival needs are social, do people like us enough to hire us? Do we solve problems well enough for other people to do our job for as long as possible? Those are the more like quote survival based threats rather than like physical dangers and things like that. Or at least those are the things that lead to physical dangers, lack of resources and everything. That it hacks this weird part of our self-fooling mechanism, where then we sort of tell ourselves whatever the stories are about the practice that we run, or the things that we do, or how evidence informed we are, or what the evidence even says, even all the way down to what evidence we even choose in the first place to expose ourselves to. Because one of the ways in which we can stay right is to just maximize what we don't know. Like,
Hmm.
just don't go in that quadrant of knowledge. You know what I mean? There's what we know, there's what we know we don't know, and then there's what we don't know we don't know. And like, just don't go in there. And then that makes it really easy to make the math work on top of that, because you didn't even expose yourself to something in the first place. And that's another version of like self-fooling that happens on a unconscious or semi-conscious kind of level, that we
Hmm.
have to we have to just watch out for it. Because again, it's not because people are unintelligent, it's not because people are bad people, it's just because it's part of like kind of the bugs in the human software that is innate to all of us. And so I keep saying that point because it's not to be like talking badly about anybody in particular. It's we're all susceptible to this, and we just have to come up with just some systems to kind of bump us out of that and like wake us up from the trance a little bit.
Hmm. Yeah, absolutely. Yeah, that quote kind of looped us back a little bit to some of the stuff a little bit at the beginning. Um, but yeah, hopefully we kind of connected some of those dots there, and I think that worked out fairly well. I think just to kind of wrap up. we going back to a little bit about that final point about, well, actually, let's loop into here. I think just kind of to wrap it up, I think you've created a really open atmosphere and a perspective from yourself. You called it essentially like a treatment system agnosticism that like can be very beneficial for someone that is trying to find their way. Let's say you're a new practitioner, or you're diverging. You've maybe been, like you said, maybe you've been disenchanted. And how do you explain how that fits into what you do, and maybe some other young practitioners out there listening or trying to find their way can um, can just maybe kind of absorb that, evaluate it, and put it into a little bit into their thought process.
Mhm. For me, the big transition in my way of thinking was to really try to reduce everything that we do technique wise or approach wise, really to just boil it down to the physiological principles. Because at the end of the day, for the type of care that we do, that we take part in, is that we're trying to adjust physiology. And we do different things that have different levers on different branches of physiology, depending on what you treat and depending on the techniques you use and are licensed to use. But at the end of the day, it's just levers that are pulling on physiology to try to get an adaptation to happen in these circumstances. Surgery is a whole other thing. And, these other types of like high force interventions, that's a different thing. It's still physiology, but it's different. In our case of dealing with maybe more chronic conditions or things like that, we're talking about trying to set up the circumstances by which somebody's physiology can adapt. And so when we get lost in the weeds a little bit about, well, this person and this system of thought says this, and then over here somebody says something completely different, and blah blah blah. I think really at the end of the day, I don't trust what a system says is the reason by which the mechanism by which it works. I try to think, what are the other ways in which this thing could work? Like, to use the acupuncture thing, I don't think that needling certain acupuncture points adjusts energy flow in a meridian. I might be wrong, but I don't think that right now. I think that we stimulate peripheral nerves, and I think those peripheral nerves signal something back centrally to the brain, and it changes blood flow in the brain, it changes neural activation, and that creates a different platform by which an adaptation can take place. And so you go to and a young acupuncturist would go to let's say like a pain management acupuncture course or something, and they're talking about all the channels and whatever. If you know enough about like the peripheral nervous system, or you know enough about how the autonomic nervous system organizes, you can then decode techniques and be like, I think this is actually why it's working. Then you can also generalize it to say, well, if this is leveraging this part of the system, this technique over here is kind of doing the same thing. And what if we stack them together? Because I don't care about technique A and technique B, I care about what they're pointed at. And then we're stacking things that have leverage on a particular branch of physiology. And now you can begin to come up with your own approach in your own system, not taking anybody's system's word for it. I'm not saying that everything they say is wrong, but we're just saying like let's maybe widen the frame a little bit and say, what if it works by another mechanism? Or what if what's really making 75% of this work is this other thing over here? And the more you can learn about basic science of physiological systems, depending on which system you treat the most, maybe you treat the GI system the most, or maybe you treat the nervous system the most, or maybe you treat the cardiac system, whatever, really going back to first year basic sciences of that and really getting that airtight, and then stacking things on top of that and trying to see whatever new technique that you go pay to learn how to do, or new approach that you go pay to learn how to do, to try to then decode it back to that level. I find it's just a really grounded way to sort through information instead of just getting swept up in the continuing education. you know to be honest, it's a farming system. You know what I mean? They try to get you to convince that they've got the answers, and that you got to come back for level 2, and you blah, 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 blah. And that's its own self-perpetuating thing that we can also kind of jump the line on, and you don't have to go through that process. So reducing it down to basic sciences level and really understanding physiology is, I think, the best groundwork that you can lay as a new provider.
Yeah, I absolutely agree. I think that um, it's just so interesting that you said that. You know, we almost assume there's an assumption that once finish your quote unquote didactic learning and you've studied all this physiology, and that for most medical students that's like year one and two, right? So you're done, you're essentially like done learning biomedical physiology. And I mean, honestly, to your point, that couldn't be further from the truth, because if you are going to obviously dive into different specialties and things like that, you're going to go deeper. But I think you mentioned a really good point there, just the responsibility to just get that system, like dive deeper into those systems, whatever kind of conditions you treat, or whatever types of patients you see, what systems are at play. And if you think of the integrative model, you could essentially connect them all. So you should be kind of diving into those systems on a consistent basis, and just like relearning and reminding yourself, wow, like I've totally forgot about that. But obviously it's kind of a recommendation a little bit more for those that are kind of in this world and in this type of practice, which is really fantastic advice. And I couldn't agree with that more. Certainly, having a long career in the kind of the health and fitness world, where evidence and practices are always changing. But certainly in the medical world, we have that responsibility as well. And if you're really trying to you know hone your practice, and like you said, stack those levers, which is really another good visual and metaphor for people to understand. That kind of adaptive medicine is what, like you said, we're not we're not cutting through the physiology. We're trying to, like you said, make little changes in the body. So I think that's just really an important point. And I think we can just start to kind of wind it down on that. Just take home, dive in. We've covered so much today, from some of the stories, but also from some of the like theoretical and philosophical standpoints, but practical too. I think I really appreciate your time, Matt, and um, it's been great to just chat it out. And any final thoughts from you on anything that we touched on today to wrap it up?
Yeah, well, first of all, it's really great to chat, and it's really great to sit down and talk with people who are asking these questions, because I can't tell you the number of times in my community, in the acupuncture community, that I've been met with like a lot of resistance, even for asking the questions. You know what I mean? Like that, there was almost this sense of just like indignation that we would even go there. So to go there now in such an open and humble way, is perhaps more of a relief for me than you could maybe imagine, because of some of the things that I've been through in my community
Mm-hmm.
and my background. So I appreciate it.
Mm-hmm.
And so final thoughts were just are really just an extension of that, about how I think it's hard to ask the questions like this because of all the things we mentioned. It's painful. Like, we've done research where when we come up with we'll come against the information that deflates our biases and our previous thoughts, the same centers of the brain light up as when we experience pain. Like, it is literally neurologically painful to come in contact with these difficult questions and these other pieces of information. But the thing that I always come back to is just, it might sound a little sentimental and corny, but like I took the oath, man. Like, I took the Hippocratic and the Chinese medicine oath, like, in the room on the day, and like, I signed up for that, and I take that seriously. And I think that at the end of the day, what makes it less painful is unburdening the sense that you have to have answers, right? This is what we said before. We have to have a process, and we have to listen, and we have to ask, and then we have to make informed decisions. but it becomes less painful when we're just like trying to hold on really carefully and tightly to being right as opposed to being responsive and being reasonable. And that's what we're after, and there's a certain flow that then can come from that place if that's your attitude, as opposed to like, I'm the evidence-based right person, and I'm just going to nail it every time, and I'm just going to be here to tell people what to do and all this. It just does it. That's just not it. There's pseudoscience and then there's pseudo certainty, and both of them are incredibly soft and weak, and are not a great platform from which to help people. And so I think that when the a priori condition we approach this process with is like, man, I'm never going to know, I'm going to check out before I even get 2% of the way there, so I'm here to be as reasonable, informed, and responsive as possible, and like right is not even on the radar. And that, there, for me at least, maybe this will resonate with some people, for me at least, that was an incredibly freeing thing. And it's not to say, well, it doesn't matter if people get better or not, because that's still, a hugely important thing, but we're talking about the how, and that how, I think, will change the way that we interact with people in a helpful direction if that's our approach, as opposed to just trying to confirm that we're good enough and right enough and just grab onto something as hard-edged as that.
Amazing. That's such a refreshing and humble way to finish it off, Matt. Thanks so much for that wonderful, wonderful chat. Thank you, everyone, for listening. If you enjoyed our discussion today and would like to hear more, please subscribe and follow us on Instagram at naturopathic.performance. Leave a rating and a review or a message on any subjects you might like to hear in the future. Thanks so much. Until next time.